Hello, my name is Dr. Jim Wrobel. I'm a podiatrist at the Villages Health, and I've been practicing for about 30 years, and I was excited to give this presentation because it's been my mission over the past 30 years in academic practice to try to optimize foot health in folks with diabetes and foot problems. And I've been fortunate to have grant funding from the National Institutes for Health as well as the VA, and had worked in positions with the American Diabetes Association. So I think it gives me a perspective to share with you some of the research I've done in the area, as well as share some stories of patients that I've had over the past 30 years to try to keep your feet healthy. What I'd like to do today is share some resources that I've been fortunate to make with you, and also talk a little bit about diabetic foot complications, maybe presented differently than what you've heard in the past, and hopefully with this format to address frequently asked questions. And lastly, to talk about what's new in prevention and trying to prevent foot sores and amputations. I came across this great slide on the internet that's attributed to bruceholmes.com, and it was an image that I've included here. And I think it really depicts what shoes do to the feet over time. This is the same person wearing two different types of shoes here. On the right, you see a wide, non-tapered toe box. You see the toes are in good alignment. There's no angle changes. There's very little toe muscle activity, and the foot looks pretty relaxed. If you look on the left side, you'll see a tapered toe box where the toe box is too narrow, and you see what happens to the shape of the toes. The big toe turns in, the little toe turns in, and these toes are very active. It almost looks like they're starting to form a bunion deformity here, hammer toes, and maybe even a tailor's bunion on the side. And I've come to believe over time that you don't break in shoes, they actually break your feet. You know, we've had this myth growing up that eventually your shoes will break in, but I really don't think that's the case, especially if you have neuropathy or poor circulation. Now, this is some research we did at the VA in Vermont, and we surveyed about 200 veterans, and we wanted to check their shoe size. And it turns out shoe size changes over time, and it's very frequent. You can see from this figure here in the 200 patients we surveyed, we measured their shoe size with a Brannock device, and we compared their entry physical exams into the military to find out what shoe size they were wearing at that time. And on average, the shoe size change was about one full size, almost 1.5 or 1.5 increased shoe size over time. And you can see this happened at an early age too, anywhere from 50 to 59. A good proportion of patients had changes in shoe size. And then once you get to 60 to 64, that had the highest change in shoe size reported. So it's a very good idea to get your shoe size measured so you can make sure that you have adequate length between the longest toe that you have and the end of the shoe. And a very easy thing that you can use there is the width of your pinky finger or the width of your thumb to make sure there's no rubbing at the tips of the toes. The other thing that I've heard in the past from patients when we examine their feet is, I never go barefoot. I wear socks in the house. And people think that, you know, socks will protect their feet. And in my experience, there's no such thing as magic socks. You know, with people walking on tile floors, if they had a little pebbles or little fragments of wood, or they're doing gardening work and they track these things in the home, or if you're a snowbird and you're tracking in salt into the home. If you walk barefoot or with socks, those things can embed in the bottom of your feet and create irritation or even a foot sore. So the socks really don't protect the bottom of the feet from those types of injuries, especially if your feet are numb. Now, one resource that I was able to put together was to create this educational video, and you can find this at YouTube. It's called Clear Offloading, and it's about a 9-minute video that tells you the importance of wearing shoes that take pressure off the bottoms of your feet, and try to educate folks on how to have foot health. So what I'd like to do is share a brief segment of this with you. Now you can see this young man is performing a daily foot exam, and he reported it was difficult for him to see and reach his feet, and you can see how he was able to negotiate this or manage it was to get on the side of a sofa or a love seat and just bring the side of the foot up there so he could see the bottoms of his feet, look between the toes, make sure there's no new sores or no new blisters, and he's able to use foot cream on there. So I'll just proceed with this video, and you can see how quickly this takes to perform a daily foot exam and to put lotion on the feet. And what the lotion does is with the, you're massaging the feet, you're having the skin more hydrated, so it's less likely to break down. And that's a very important part of foot health here. Now, the other resource I was fortunate to put together is I was interviewed by WebMD, and they wanted me to talk about preventive strategies for foot care and trying to prevent foot ulcers and amputations. And we'll make this content available. You can contact the educational folks and Amy, and we can get the PDF sent out to you if you're unable to access it. It's a 2-page article, and it talks about some common sense tips. And I'll talk about this throughout the presentation today, but it's nice to have it in one spot, and we'd be happy to provide that to you. So I wanted to talk about some of the complications with diabetes and why this is important to try to prevent foot ulcers or foot amputations. And a lot of people hear about neuropathy. If you're around the pool, which is the village's best communication mechanism, it's great. You know, you don't have to worry about power failure or Wi-Fi access problems or new software upgrades. It always works. And people talk about their different experiences with neuropathy. And there are individual experiences. One of the first things to happen if neuropathy is starting with diabetes is you may develop cold feet. And a lot of people will attribute that to poor circulation. And basically what it is these small nerves around the, in the feet will tend to lose their temperature sensation. That's one of the first things to go with neuropathy, and that's why it's important to try to avoid temperature extremes. So if you're going to the beach, make sure that you have your feet covered or have sunblock on them, or avoid soaking your feet in too hot of water. Otherwise, the thermostat to your foot is not working properly, and it's easier for you to get a burn, or it's easier for you to develop frostbite if you're a snowbird and you're heading back north and you're exposed to cold weather. Now, some of the typical sensations that people get with neuropathy are the classic descriptions of numbness, tingling, burning, stinging sensations, shooting sensations, or people describe it as a vice-like sensation where their foot is being squeezed in the ball of the foot, or they might have this sensation of bugs crawling on their skin. It tends to be worse at night. It starts at the tips of the toes, and the bed covers can irritate their toes at night. The other thing this can affect is the nerves into the muscles, and it can disrupt your balancing strategies, or you have poor balance, which I think is a poor term because I think we're always balancing everything in our lives, including when we're walking around. Now, the combination of all these things can lead to stiffness in the joints and result in pressure points on the feet, and that's when callus formation starts. And I'll show you a little bit about that in the video when we get there. The other thing that can happen is it's a different type of circulation issue with diabetes. The narrowed blood flow tends to be more in the calf area, which does make it more difficult to improve circulation in the area, but there have been a lot of advancements in vascular surgery within the vessel itself to try to improve circulation, to diminish those symptoms, or to get a wound to heal. And if you have neuropathy on top of it, you may not feel the circulation symptoms when they start to happen. So that's why a comprehensive foot exam every year is a very good thing to have. Now, if there's one thing I can try to convey to you, one thing that you can take away from here is that foot ulcers are not just abrasions or blisters on the bottom of the toes. This is how foot ulcers start, and they turn into a chronic wound. So it's important to have abrasions looked after, blisters to cared for, and close monitoring those so that don't become chronic foot ulcers for you. And I'll show pictures of that later, and I'll warn you when that's going to happen for those of you that rather not see a graphic clinical picture. I think the best news about this is that foot ulcers can be prevented. Now, since I've been at the Villages for about a year, I've seen probably the two most common reasons people will develop foot ulcers is they're breaking in new shoes. So remember from that first slide is that the shoes don't break in, they break your feet. So you want to make sure when you're breaking in new shoes is that you wear them for a small period of time, maybe an hour the first day, and then check your feet to make sure there's no pressure sites where there's red spots or blisters or callus formation, and gradually build up your activity over a 2-week period when breaking in new shoes. And you always want to be measured to make sure you're in the proper size footwear. Probably the biggest reason people will develop foot ulcers are changes in activity. And this is some areas that we've done research in, and I'd like to show you what we found out. We are creatures of habit. You know, we all have similar types of activity that we're accustomed to. We actually put pedometer, or not pedometers, but it's a body-worn sensor that people wear on their chest in a specially designed t-shirt. So we could measure standing time as well as the number of steps per day. And what we found is that the vast majority of activity were small bouts of activity in the home. People were taking less than 50 steps at a time, and eventually they might take larger steps when they headed out to do some shopping or social activities. But this person still did 7,000 to 7,500 steps a day. But it's very tightly regulated. There's not much variation in activity. Now, my colleague David Armstrong, who's at the University of Southern California, did this research, and he found the people that ulcerated had a wide range of activity. So these are the group that they followed with pedometers. They had no variation in activity. They didn't ulcerate. Now, the people that ulcerated, they had a wide variation of activity. And this is what I've been seeing at the Villages, is that folks will go out on a hiking trip. When I was back in Vermont, people would go to town fair in the summertime, and their feet were accustomed to this activity, only 50 steps at a time. But now all of a sudden they're outdoors, they're walking in different shoes, and the demands on their feet are very high, and that's when the foot eventually breaks down and a skin ulcer occurs. So this is one of the areas of prevention, is to make sure that you're wearing appropriate footwear and you're breaking in the footwear before you go on your trip, or also getting your feet and lower extremity accustomed to that type of motion before you leave and that type of activity. Most commonly, we'll see it in people going to cruises, going out to Disneyland or Disney World, I should say, and they get stuck out there and they're not wearing appropriate footwear. They might be wearing flip-flops and they're not wearing the shoes they're accustomed to, and that's when they end up with foot ulcers. Now, I'd like to talk a little bit about some frequently asked questions. Unfortunately, in this environment, it's hard to share questions, so I tried to come up with a few suggestions here. One of the biggest questions I get in my practice, are pedicures safe? And the short answer to that is they can be in people with low-risk conditions. So that's why it's important to have a comprehensive diabetic foot exam every year. If you have poor circulation or poor feeling in your feet from neuropathy, it's probably not a good idea to get pedicures. One of the very sad stories I had when I practiced in Vermont is we did have a veteran that got a pedicure when he traveled to Florida and came back and eventually lost his leg because he had such poor circulation from a pedicure that caused an infection in his toe. It's an extreme case, but it's something we want to be mindful of. If you don't have poor circulation and neuropathy, their pedicures are probably safe. It's a good idea to let your pedicurist know that you have diabetes and to avoid any aggressive nail care on the sides. A lot of times they will tend to try to take out all the callus material there and trim back the toenails, and we prefer not to do that. We'd rather have the toenails grow out to the pulp of the toe rather than constantly being cut back. They are required to use sterilized instruments, and they are now using a liner inside the soaking bin, and that's potentially an area in the past, if they didn't use liners, that we might see people develop fungus infections in the feet. Now, another frequently asked question I get is, do I need diabetic shoes? And the short answer to that is if it's hard for you to find over-the-counter footwear, you probably need diabetic shoes. Or if you're unstable with walking, you probably need diabetic shoes. And what I mean by that is if you've had loss of feeling in the feet, you have calluses on the bottom of the feet or corns on the toes, if you have bunions where the big toe joint's angled, or you have hammer toes where these toes are buckled, or a tailor's bunion here where this baby toe is angled, then diabetic shoes are probably helpful. The nice thing about that is they've changed quite a bit, and I'm going to talk to you a little bit about that later on. This is a very good time to be alive for different types of footwear. This is vastly improved since I've been practicing, and particularly in Florida where we love to wear sandals and flip-flops. There are many options for orthopedic sandals now that we didn't have in the past. It used to be in the day we just had Birkenstock sandals that had the cork insoles, and if that cork insole didn't fit you properly, it was uncomfortable and it was difficult to wear. The reason why these are important with orthopedic sandals is they give you some arch support. And if they don't have that thong that goes in between the toes, it doesn't necessarily change the way you walk so much. When you do wear a flip-flop and you have that thong in between the big toe and second toe, you tend to hold those two toes together subtly when you walk, and the range of motion of your foot is diminished, and over time that can lead to stiffness in the feet, or flattening of the arches. So that's why these orthopedic sandals can be helpful. They have more arch support. For those of you that have plantar fasciitis before, probably the two biggest recommended orthopedic sandals are UFOs and Vionics. SAS are San Antonio shoe. These are the classic nurse's shoes, but they do have orthopedic sandals with a good arch. For those of you that are hikers, Keen offers a good one, as well as OrthoFeet, which is part of Vionics. This company, Naote, also offers some orthopedic sandals, as well as Telic. Spenco offers these, and they have a metatarsal raise, which is a pad underneath the ball of the foot that can help. Crocs has been offering these for years, as well as Clark's. Now, the problem with orthopedic sandals is they don't support the heels. They don't cup the heels. So if you're somebody that's prone to develop cracks in the heels, it's probably not a good idea to live in these very often. You know, better to wear them for short bouts of activity because that can make the cracks in the heels worse. Now, another question I get is, do I need rocker soles for footwear? And if you do have some arthritis in the big toe joint up in here, if you have some gait instability for multiple reasons, whether it's loss of feeling in the feet or weakness, or you're prone to falls, these can be a helpful strategy. And what is meant by a rocker sole is that you can see the pitch of this shoe is tilted up, but the inside of the shoe is fairly flat. So if you have a stiff big toe joint, the shoe does the motion rather than you having to bend the shoe. If you tried to bend this shoe, it would be very difficult to do that, and that's what the metatarsal rocker does. You can see a lot of these stability features in the back part of the shoe. Usually they give you a plastic heel cup, and with this broad-based heel, this makes it a lot easier to walk if you're unsteady on your feet. New Balance has offered these for years. They have the 928 or 847. And I'll talk to you about shoe stores in a minute that offer these, that are locally in the villages. Brooks offers the Beast or the Addiction, and we can get you handouts for this as well if you were to see us. Hoka is a little bit newer to the scene with some of these rocker soles, but these are very popular with folks in the villages because they do have a mesh upper that won't rub on the sides where people have bunions or hammer toes. And you're looking for a mesh upper here because it won't irritate these toes if they start to buckle for you. We have a lot of local resources in the villages that can help us out with footwear. All About Feet is over by Walmart on 466. They have, Tim is a cobbler that works out of there, and they have excellent knowledge over the years of his practice to point you in the right direction of shoes. For Feet's Sake is in Sumter Landing, and don't be taken back by the small size of the store. They are packed in with a lot of good orthopedic supplies. Shoe Biz, we have one in Brownwood that's a little bit smaller that has a lot of the orthopedic sandals that I talked about. There's also an SAS store over there. The nice thing about SAS is they have a wider, deeper toe box. It's aligned inside of the shoe, and it's a leather with a little bit of a rocker sole. And also some resources outside of the villages that are in the community here, Fit to Run. You'd have to travel a bit to Gainesville or Tampa. They have more of the higher end specialized athletic shoes, and they have a little bit more of the higher end prefabricated foot orthotics, and you can get some foot orthotics made there. Hitchcock Shoes is a resource that's out of the Commonwealth of Massachusetts. They've been around for a long time. They specialize in people that have wide feet. You can find them at Hitchcock Shoes online. They come up to 8E in width, and they're a very good resource for that. So with these frequently asked questions, the question is, do I need diabetic shoes? And hopefully I talked to you about that. If you do have those conditions we talked about, your podiatrist can prescribe these for you, and they can write a prescription for the type of custom foot orthotics that can go inside the shoes. Usually insurance companies will pay for that if you have qualifying conditions, and they give you 3 pairs of foot orthotics, which will give you all the stability features that I talked to you about before. This does have to go through your primary care doctor once we write the order for it, and those can be arranged for you locally. The last thing I'd like to talk to you about from prevention is what should I be doing for my feet? So we can go back to the video there shortly. So this gentleman is getting up, and he's just going to go use the restroom at night, which sometimes people have to do a couple of times a night, and it really does not want to put on his shoes or his offloading device. And this is where people run into trouble. You see there's his offloading device there. He's not wearing it. He's heading to the restroom. Now take a look at the pressure points that develop on his foot when he doesn't have his offloading device on. This is in our gait lab that we filmed this footage of this patient, and these spikes of high pressure are the things that will lead to ulceration or prevent that ulcer from healing. That ulcer heals at about a dime's width every day. So if you don't wear your offloading device, it's not going to heal. We have to take pressure off of this to heal. And you can see where these high pressure sites are on the left without the device on, and on the right, he has the device on, so you can see all this pressure reduction that happens. And that's what we're after here. The other thing that's important here, this is my research manager, Ryan, and he is walking barefoot here, and it's a demonstration of what can happen when you walk barefoot and you don't feel it. Now, I won't get graphic here, but you can see the pressure points that develop when you walk barefoot. You can see this is a glass slide that he's walking on. Look at all the circulation that's gone away from the skin. And when you stand for a prolonged period of time, this circulation doesn't come back here to heal things up. And you can see how thick the plantar skin is, or the bottom of the foot. It's about a 1/4 inch thick. So it's not uncommon where we find things in people's shoes where they don't shake out their shoes before they put them on. I've seen golf tees in there. I've seen critters in there. I've seen keys in there, pennies, all kinds of things that leak out of people's feet or either their pant pockets if they have holes in them, and they end up in their shoes, and then they end up with a bad issue on the bottom of their foot. So I'd like to finish with what's new in prevention. Dr. Comfort is a shoe company that came out in Wisconsin a few years back, and they've really revolutionized orthopedic footwear, or the quote-unquote diabetic shoes. If you went on their website, drcomfort.com, or Anodyne is another company that we deal with, they've really come up with a number of options that look more like dress shoes if you require them. There are some that look like boat shoes. Their athletic shoes are very lightweight, and that's an important consideration. Even when we get our patients with really lightweight shoes and orthotics, they still feel like they're heavy to them, but they are so much lighter weight than the shoes that they used to wear in the past. And that does make a difference with fatigue with walking and standing. The other thing that's really been a new area of prevention is this idea of a thermal sensing bath mat. And I'll show you a picture of this. This was developed at MIT, and I'll talk to you a little bit about the research behind it. And the third thing I'd like to talk about is activity dosing, which we can all do today. So with this prevention with the bath mat, this was developed at MIT from some engineers, and they would take thermal sensors. It's a bath mat, and all you do is stand on it. You activate the thermal sensors, and then you deactivate it. It all gets transported online, and it's analyzed online with sophisticated artificial intelligence software, and they look at these thermal images. And if they see about a 4-degree difference between feet, that's an area that could eventually become a foot ulcer. And in their original study that they published, it's now, it's about 2 years old now, they found that about 29% of the folks developed a foot ulcer during the observation period, and they were correctly identifying 97% of them based on their thermal image in this bath mat. and they could identify them about 37 days before it became a foot ulcer. So this was exciting technology. They had some false positives that were about 3 notifications a year. So if you're an anxious person and you get an alarm feature like this, you might be concerned about it. But typically somebody that's at high risk for foot ulcers, we're seeing at least 4 times a year anyway. So it didn't seem to be that difficult for us. Now, the other thing that was important about this is most of the people found it, 98% of them found it easy to set up, and about almost 90% of it found it was easy to use. This is being used now in the VA, and they're probably the first big health system to use this, and we'd anticipate other health systems will find the value in using this. Right now, it's not widely available. People can simulate this type of technology by using the infrared thermometers that a lot of us purchased with the COVID-19 breakout or pandemic. And you can actually measure the temperatures on the bottom of the feet and compare them to the other side. And if there's a 4-degree Fahrenheit difference, that's something that should be checked out because that might be the early signs of a foot ulcer. Now, the other thing, as I mentioned before, is we can dose activity. As I mentioned before, most of the time it's this variability in activity that caused people to ulcerate to begin with. What I'd like to do is take you through a case that I had at the University of Michigan before I came here. It's going to show pictures of a foot ulcer, so if you're a little squeamish, you may want to look away now, and I'll tell you when you can look back. So I'm going to advance the slide now, so if you'd like to look away, please do. Basically, you know, we all have, or I shouldn't say we all, but most of us have a smartphone that has one of these activity monitors on it, and it tells you how many steps you take a day. And it's very easy to modify this, put an alarm feature on it, or if you have a Fitbit, you could put an alarm feature on it and tell you when you've taken too many steps a day. So this is the gentleman I was talking about. He was delivering groceries for a living. He would see typically 6 people a day, and he would take between 10 to 15,000 steps a day, and he formed a very bad toe ulcer at the end of his big toe. And you can see the number of steps he was taking a day. So we asked him to moderate his activity, and you can see here he did moderate his activity. His steps per day decreased to about 2,000 to 3,000 steps a day, and he did this by only taking care of 3 folks a day for delivering grocery rather than 6, and you can see the improvement in his toe ulcer. Now it improved, but it kind of stalled. So we decided to put him in what we call a total contact cast, and that probably has the best healing capacity. It's one of those removable boots that you can make irremovable by putting some cast tape on it. And you can see that his activity diminished once we put him in the cast. The ulcer started to look better, and once he learned how to walk in it again, unfortunately he increased his activity again, and this resulted in the ulcer healing stalling. So we asked him to make sure he continues to just take care of 3 folks a day, and he went back to decreased activity again, and you can see eventually he healed this up at the end of his toe, and we got him some orthopedic shoes, and we were able to monitor his activity once he was breaking in his orthopedic shoes, and he has stayed healed since then. So this is great technology that we can all use, and it's all personalized. We have to figure out how many steps a day you do take and how many steps a day we need to diminish to try to get this to heal. Now, I had a talk last year about foot injury prevention at the villages, so I thought I'd share this one slide again because it does have bearing to prevent foot ulcers. Remember, these are some tips before you go away on vacation. Make sure you're breaking in the shoes or the boots that you're going to bring on vacation. Make sure you wear the right footwear for the right activity. So if you're heading out, make sure you bring different types of shoes with you. So if you get caught at Disney World, you have a good pair of supportive shoes that you can wear rather than kind of fighting through it with flip-flops. Make sure your feet are accustomed to the stresses that you'll experience on your trip. So you want to try to gradually increase your walking activity before you head out on your vacation so that the soft tissues and the skin, they can all get accustomed to that activity before you actually go. Make sure you have appropriate lighting at night. I know this is a kind of a sticky point for folks in the villages because they don't want to wake up any of their loved ones if they have to use the restroom at night. But there are innovative lighting techniques that can be done that are along the floor that aren't bright and don't restrict sleep quality, but will at least illuminate the path to the restroom so you're not damaging toes and stepping on anything or having a fall. Now, one thing everybody's very in tune with at the villages is maintaining strength and optimizing flexibility and optimizing balancing. Amy has offered a number of great courses for this. And I think that's important because that gives you a reserve. And when you have a kind of a functional reserve and you do get injured, it's much easier for you to bounce back for those injuries if you didn't have that type of training with the flexibility, strength, and balancing. This is just a slide that tells you try to keep these toes and these ankles flexible. With diabetes and long-standing elevation in blood sugars, it causes stiffness of the tendons, and Achilles tendon is one of the areas that will tend to get stiffer. And these exercises people use for plantar fasciitis. You can get on the side of a stair here, count to 30, relax, and then allow your feet to drop a little bit more and count to 30 again. So you're doing it for about a minute, and that can keep flexibility in the ankle joints so you're not putting so much stress on the ball of your foot with walking. This hurdler stretch is another way to do that. This stretch is a good way to try to prevent hammer toes from getting worse. So when you start to get contracted toes here, if you push these toes down at night or hold the ball of your foot up against a stair, or not a stair, but like an ottoman or chair, and push down on the top of the toes and do the same thing, count to 30, relax, count to 30 again, so you do it for about a minute. These types of things can keep the hammer toes flexible. And one brilliant strategy that one of my patients shared with me, which I would like to share with you, is that when Final Jeopardy came on, he was a big Jeopardy person. When they queued up the music for Final Jeopardy, that was a bell in his mind that caused him to perform his foot stretches. So he ended up performing it, at least 5 days a week, because every time Final Jeopardy came on, he would start to do his foot stretches or toe stretches, and he would be done before Final Jeopardy completed. I also get questions about nail health. And to try to prevent fungus toenail infections, there are some things that you can do. One is to avoid going barefoot on carpeted floors. We've already talked about that with socks. Try to have some sort of sandals, orthopedic sandals, to protect the bottoms of your feet. The other thing would be to avoid going barefoot in public areas. So at the pools and the showers at the gyms, make sure you have shower shoes and that type of thing. You'd like to use wash your socks in hot water if you can, and that will kill the fungus. It's unclear on whether color safe bleach actually helps with that, with the colored socks, but it is worth a try. And then to fumigate out closed shoes, if your feet get wet a lot, if you're a gardener, if you're a dew sweeper playing golf in the morning, you might want to have a spare shoes that you wear every other day, or you can put some medicated foot powder in there, spray them out with Lysol spray maybe once a week to try to prevent the fungus buildup in the shoes. And then you want to make sure you're cleansing the tubs and showers with Lysol or bleach, which I'm sure we're all doing with the pandemic. And if you use athletic performance socks, these are better because they tend to wick away the moisture rather than just 100% cotton socks, and try to avoid any types of seams that might rub on that area. So I'd like to summarize this talk and summarize it with the biggest bullet of all, and it's something we didn't even talk about, and that is the importance of maintaining your blood sugar. That is very important to try to prevent neuropathy. If you maintain your blood pressure and cholesterol in good control, that's going to try to prevent cardiovascular disease, which is also peripheral arterial disease, and these are all essential for preventing foot complications. Make sure you're wearing appropriate shoes, and remember there is no magic socks. Please have some sort of protective slippers or footwear that you wear in the home. We all showed a video about foot exams and the importance of potentially using lotion. If you are going to use lotion, try to do that strategically where you're not walking on a tile floor afterwards and have a slip or a fall. So you might need to do that right before you retire at night or first things in the morning, and then put socks and shoes on, whatever works out best for you. And then keep your feet flexible, strong, and continue to do the courses that are offered here at the villages. Things like Tai Chi have been shown to help patients with peripheral neuropathy maintain their balance and strength gains. Yoga can also help with that if you're able to do that. That might be more difficult for several people, especially with the challenging poses of one-leg poses. And then probably the biggest lesson is to be mindful of activity variability. When you go on that trip, when you head down to Disney World, make sure you're wearing the appropriate footwear, take some frequent breaks. And I'm hopeful that you benefited from this talk. Please try to share this with somebody that might need it, or point them in the right direction where they can get care for your feet. And please make sure that you get a comprehensive foot exam every year. I thank you for your attention, and we can circulate some supportive materials with this talk if you request them individually. Thank you.